HESI Nursing Challenge Test. Question 1. A client with chronic obstructive pulmonary disease, COPD, is being taught by a healthcare provider. Which statement by the client indicates a need for further teaching? I will avoid smoking to prevent further damage to my lungs. I will eat smaller, more frequent meals to avoid feeling bloated. I will exercise every day to improve my strength and endurance. I will drink plenty of fluids to help thin my mucus. C. I will exercise every day to improve my strength and endurance. Correct answer. The correct answer is C, because daily exercise may exacerbate COPD symptoms in some cases. Individuals with COPD may experience increased shortness of breath and fatigue during physical activity. Therefore, it is crucial to tailor an exercise plan to each client's specific needs and capabilities. Choices A, B, and D are correct as they align with COPD management strategies of smoking cessation, dietary modifications, and hydration to help with mucus clearance, respectively. Question 2. A client with emphysema is being assessed by a nurse. Which clinical manifestation should the nurse expect? Decreased chest expansion, cyanosis, pursed lip breathing, bradypnea. C. Pursed lip breathing. Correct answer. The correct answer is C. Pursed lip breathing. In emphysema, air becomes trapped in the lungs due to damaged air sacs, making it difficult to exhale. Pursed lip breathing helps to prolong exhalation, preventing air trapping. Decreased chest expansion, A, is more indicative of conditions like pleural effusion. Cyanosis, B, is a sign of inadequate oxygenation, which is not a primary manifestation of emphysema. Bradypnea, D, refers to slow breathing rate, which is not typically associated with emphysema. Pursed lip breathing is a characteristic and effective coping mechanism seen in clients with emphysema. Question 3. A healthcare professional assesses a client who is experiencing an acute asthma attack. Which assessment finding requires immediate intervention? Loud wheezing, increased respiratory rate, use of accessory muscles, silent chest. D. Silent chest. Correct answer. The correct answer is D. Silent chest. This finding indicates severe airway obstruction and impending respiratory failure, requiring immediate intervention to prevent respiratory arrest. Silent chest means minimal or absent breath sounds, suggesting no air movement, which is a critical emergency situation. Wheezing, A, increased respiratory rate, B, and use of accessory muscles, C, are common in asthma attacks but do not indicate as severe a condition as a silent chest. Monitoring and addressing a silent chest promptly is crucial in managing acute asthma exacerbations. Question 4. A nurse teaches a client with tuberculosis, TB, who is being discharged. Which statement by the client indicates a need for further teaching? I will take my medication as prescribed. I will need to have regular follow-up chest X-rays. I will be able to return to work immediately. I will use tissues to cover my mouth when I cough. C. I will be able to return to work immediately. Correct answer. The correct answer is C, because a client with TB should not return to work immediately due to the risk of spreading the infection. Taking medication as prescribed, A, having regular follow-up chest X-rays, B, and using tissues to cover the mouth when coughing, D, are all important aspects of managing TB and preventing its spread. Returning to work immediately can put co-workers at risk of contracting TB. Therefore, the client should understand the importance of taking precautions and following healthcare provider recommendations to ensure proper treatment and prevent transmission of the disease. Question 5. Identify the three layers of the heart: endocardium, myocardium, epicardium. epicardium, pericardium, endocardium, myocardium, endocardium, pericardium, pericardium, myocardium, endocardium. A. Endocardium, myocardium, epicardium. Correct answer. Rationale: 1. Endocardium, innermost layer lining the heart chambers. 2. Myocardium, middle layer composed of cardiac muscle tissue. 3. Epicardium, outermost layer forming the visceral pericardium. Therefore, the correct answer is A. Summary. B is incorrect as it includes pericardium instead of myocardium. C is incorrect as it switches the positions of myocardium and epicardium. D is incorrect as it has the layers listed in the wrong order and includes pericardium as the innermost layer. Question 6. Which heart chamber receives venous blood returning to the heart via the superior and inferior vena cava? Right atrium, left atrium, right ventricle, left ventricle. A. Right atrium. Correct answer. The correct answer is A. Right atrium. The right atrium receives venous blood returning to the heart via the superior and inferior vena cava. Blood from the body enters the right atrium through the vena cava, then flows into the right ventricle and eventually gets pumped to the lungs for oxygenation. Choices B, C, and D are incorrect because the left atrium receives oxygenated blood from the lungs, the right ventricle pumps blood to the lungs, and the left ventricle pumps oxygenated blood to the rest of the body. Question 7. Which heart chamber receives oxygenated blood from the 4 pulmonary veins and serves as a reservoir during ventricular systole? Right atrium, left atrium, right ventricle, left ventricle. B. Left atrium. Correct answer. The correct answer is B. Left atrium. The left atrium receives oxygenated blood from the pulmonary veins, acting as a reservoir during ventricular systole. This blood is then pumped into the left ventricle for distribution to the body. The right atrium receives deoxygenated blood from the body via the vena cava. The right ventricle pumps this blood to the lungs for oxygenation. The left ventricle is responsible for pumping oxygenated blood to the rest of the body. Therefore, the left atrium is the correct choice based on its role in receiving oxygenated blood from the pulmonary veins. Question 8. Which heart chamber ejects blood into the lungs via the pulmonary artery? Right atrium, left atrium, right ventricle, left ventricle. C. Right ventricle. Correct answer. The correct answer is C. The right ventricle. The right ventricle is responsible for pumping deoxygenated blood to the lungs via the pulmonary artery for oxygenation. This process occurs during the pulmonary circulation phase of the cardiac cycle. The right atrium receives deoxygenated blood from the body and pumps it into the right ventricle. The right ventricle then contracts to push the blood through the pulmonary valve and into the pulmonary artery. The left atrium receives oxygenated blood from the lungs, which is then pumped into the left ventricle for distribution to the rest of the body. Therefore, choices A, B, and D are incorrect as they do not directly involve the ejection of blood into the lungs via the pulmonary artery. Question 9. Which heart chamber ejects blood into the systemic arterial circulation via the aorta? Right atrium, left atrium, right ventricle, left ventricle. D. Left ventricle. Correct answer. The correct answer is D. Left ventricle. The left ventricle is responsible for ejecting oxygenated blood into the systemic arterial circulation via the aorta. It receives oxygen-rich blood from the left atrium and pumps it out through the aorta to the rest of the body. Rationale: 1. The left ventricle receives blood from the left atrium, which has already been oxygenated in the lungs. 2. It is the chamber that generates the highest pressure to propel blood into the systemic circulation. 3. The aorta is the main artery that carries oxygenated blood away from the heart to the body. 4. The right atrium and right ventricle are involved in pumping deoxygenated blood to the lungs for oxygenation, not into the systemic circulation. 5. The left atrium receives oxygenated blood from the lungs but does not directly eject blood into the systemic arterial circulation. Question 10. What structures hold up the AV valves and are anchored to the ventricular wall by the papillary muscles? Chordae tendineae. Papillary muscles. Semilunar valves. Aortic valve. A. Chordae tendineae. Correct answer. The correct answer is A. Chordae tendineae. These fibrous cords hold up the AV valves, mitral and tricuspid valves, and are anchored to the ventricular wall by the papillary muscles. The papillary muscles contract to prevent the AV valves from prolapsing into the atria during ventricular contraction. Choice B, papillary muscles, is incorrect as they assist in the function but are not the structures that hold up the AV valves. Choices C, semilunar valves, and D, aortic valve, are incorrect as they are not directly involved in supporting the AV valves or anchored by the papillary muscles. Question 11. Which valve opens during ventricular systole and closes during ventricular diastole? Aortic valve. Pulmonary valve. Mitral valve. Tricuspid valve. B. Pulmonary valve. Correct answer. During ventricular systole, the ventricles contract to pump blood out. The pulmonary valve opens to allow blood to be ejected from the right ventricle into the pulmonary artery, leading to the lungs. This prevents the backflow of blood into the right ventricle during ventricular diastole when the ventricles relax. The aortic valve opens during ventricular systole to allow blood to be ejected from the left ventricle into the aorta, not during ventricular diastole. The mitral valve and tricuspid valve control the flow of blood between the atria and ventricles, not during ventricular systole. Therefore, the correct answer is B, pulmonary valve. Question 12. Which valves close during ventricular systole and open during ventricular diastole? Semilunar valves. Atrioventricular valves. Mitral valve. Tricuspid valve. B. Atrioventricular valves. Correct answer. During ventricular systole, the atrioventricular valves, AV valves, close to prevent blood from flowing back into the atria. This allows the ventricles to contract and pump blood out of the heart. During ventricular diastole, the AV valves open to allow blood to flow from the atria into the ventricles. The other choices are incorrect because semilunar valves, choice A, close to prevent blood from flowing back into the ventricles during ventricular diastole, and the mitral valve, choice C, and tricuspid valve, choice D, are specific types of AV valves. Question 13. From where do these originate? Behind the cusps of the aortic valve, in an area known as valsalvus sinus. Pulmonary valve. Aortic valve. Tricuspid valve. Mitral valve. B. Aortic valve. Correct answer. Rationale. The correct answer is B. Aortic valve. This is because valsalvus sinus is located behind the cusps of the aortic valve. The sinuses of valsalva are pouch-like dilations found at the root of the aorta, just above the aortic valve. These sinuses are important in preventing backflow of blood into the heart during diastole. The other choices, A, C, and D, are incorrect because they do not originate from valsalvus sinus. The pulmonary valve is located in the pulmonary artery, the tricuspid valve is between the right atrium and right ventricle, and the mitral valve is between the left atrium and left ventricle. Question 14. This is a branch of the left coronary arteries which supplies the left atrium, posterior lateral surface of the left ventricle. Right coronary artery. Left circumflex artery. Left anterior descending artery. Posterior descending artery. B. Left circumflex artery. Correct answer. The correct answer is B, the left circumflex artery. This artery branches off the left coronary artery and supplies the left atrium and the posterior lateral surface of the left ventricle. The left anterior descending artery, C, supplies the anterior surface of the left ventricle. The right coronary artery, A, supplies the right atrium and right ventricle. The posterior descending artery, D, is a branch of the right coronary artery and supplies the posterior wall of the left ventricle. Therefore, B is the correct answer based on the specific area supplied by each artery. Question 15. Which artery supplies the anterior wall of the left ventricle, the anterior interventricular septum, the anterior papillary muscles, and apex of the heart? Left anterior descending artery. Left circumflex artery. Posterior descending artery. Aortic artery. A. Left anterior descending artery. Correct answer. The correct answer is A. Left anterior descending artery. This artery supplies the structures mentioned due to its location and distribution in the heart. The left anterior descending artery runs along the anterior interventricular groove and provides blood flow to the anterior wall of the left ventricle, anterior interventricular septum, anterior papillary muscles, and apex of the heart. The other choices are incorrect because B. Left circumflex artery supplies the lateral and posterior walls of the left ventricle. C. Posterior descending artery supplies the inferior part of the heart. D. Aortic artery is not a specific artery that supplies the mentioned structures. Question 16. Which artery supplies the right atrium, right ventricle, a portion of the septum, SA node, AV node, and inferior portion of the left ventricle? Right coronary artery. Left circumflex artery. Posterior descending artery. Aortic artery. A. Right coronary artery. Correct answer. The correct answer is A. Right coronary artery. This artery supplies the mentioned structures as it branches off from the aorta and follows the coronary sulcus to reach the right side of the heart. It provides blood to the right atrium, right ventricle, part of the septum, SA node, AV node, and inferior left ventricle. The left circumflex artery, B, mainly supplies the left atrium and lateral part of the left ventricle. The posterior descending artery, C, typically arises from the right coronary artery and supplies the inferior part of the heart. The aortic artery, D, is not a specific artery that directly supplies the structures mentioned. Question 17. During which process does coronary artery blood flow to the myocardium occur during diastole, when coronary vascular resistance is reduced? Coronary perfusion pressure. Coronary vascular resistance. Diastolic filling. Ventricular ejection. A. Coronary perfusion pressure. Correct answer. The correct answer is A. Coronary perfusion pressure. Coronary perfusion pressure is the pressure gradient that drives blood flow through the coronary arteries into the myocardium during diastole when the coronary vascular resistance is reduced. This pressure gradient is essential for delivering oxygen and nutrients to the heart muscle when it is relaxed and filling with blood. During diastole, the coronary arteries receive blood flow predominantly due to the pressure difference between the aortic diastolic pressure and the pressure in the coronary vasculature. Summary of why the other choices are incorrect. B. Coronary vascular resistance. This factor is reduced during diastole, allowing for increased blood flow, but it does not directly drive blood flow to the myocardium. C. Diastolic filling. This refers to the filling of blood into the ventricles of the heart, not specifically the flow of blood through the coronary arteries. D. Ventricular ejection. This occurs during systole when the ventricles contract. Question 18. Which structure serves as the normal pacemaker of the heart? SA node, AV node, Purkinje fibers, atria. A. SA node. Correct answer. The correct answer is A. SA node. The SA node is known as the natural pacemaker of the heart because it initiates the electrical impulses that regulate the heartbeat. It is located in the right atrium and generates the electrical signals that coordinate the heart's contractions. The other choices, B. AV node, C. Purkinje fibers, and D. Atria, do play roles in the heart's electrical conduction system, but they do not serve as the primary pacemaker. The AV node delays the electrical impulses, the Purkinje fibers distribute the impulses to the heart muscles, and the atria contract to pump blood into the ventricles. However, none of these structures serve as the primary pacemaker like the SA node does. Question 19. Where is the impulse from the SA node delayed, enabling atrial contraction to complete before the ventricles are stimulated and contract? AV node, bundle of His. SA node, aorta. A. AV node. Correct answer. The impulse from the SA node is delayed at the AV node to allow time for the atria to contract before the ventricles. The AV node acts as a gatekeeper, slowing down the electrical signal before transmitting it to the bundle of His, which then conducts the signal to the ventricles. This delay ensures proper coordination between atrial and ventricular contractions. Choices C and D are incorrect as the SA node does not delay its own impulse, and the aorta is not involved in the conduction system. Question 20. After the AV node, the electrical impulse is then transmitted into the and into the Purkinje fibers, ventricles. Atria, ventricles. Bundle of His, Purkinje fibers. Ventricles, Purkinje fibers. C. Bundle of His, Purkinje fibers. Correct answer. The correct answer is C. Bundle of His, Purkinje fibers. After the AV node, the electrical impulse is transmitted to the bundle of His, which then branches into the Purkinje fibers to spread the impulse throughout the ventricles. This sequence ensures coordinated and efficient contraction of the heart muscle. Choices A, B, and D are incorrect because they do not follow the physiological pathway of the electrical conduction system of the heart. The Purkinje fibers are responsible for transmitting the impulse to the ventricles, not the atria or vice versa as suggested in the other choices. Question 21. A client has a mediastinal chest tube. Which symptom requires the nurse's immediate intervention? Production of pink sputum. Tracheal deviation. Drainage greater than 70 ml/hr. Sudden onset of shortness of breath. B. Tracheal deviation. Correct answer. The correct answer is B. Tracheal deviation. Tracheal deviation indicates a tension pneumothorax, a life-threatening emergency that requires immediate intervention to prevent respiratory compromise. The other choices are incorrect because, A. Production of pink sputum may indicate bleeding but does not require immediate intervention unless severe. C. Drainage greater than 70 ml/hr may indicate a potential issue with the chest tube, but it does not require immediate intervention unless accompanied by other symptoms. D. Sudden onset of shortness of breath is concerning but not as immediately life-threatening as tracheal deviation in this context. Question 22. When teaching a client with chronic obstructive pulmonary disease, COPD, about nutrition, what information should be included? Select all that apply. Avoid drinking fluids just before and during meals. Rest before meals if experiencing dyspnea. Have about 6 small meals a day. Eat high-fiber foods to promote gastric emptying. D. Eat high-fiber foods to promote gastric emptying. Correct answer, the correct answer is D. Eat high-fiber foods to promote gastric emptying. In COPD, patients may experience slow gastric emptying due to decreased lung function. High-fiber foods can help with digestion and prevent constipation. A. Avoid drinking fluids just before and during meals. Incorrect. Hydration is important for COPD patients, but timing of fluid intake is not directly related to nutrition in this context. B. Rest before meals if experiencing dyspnea. Incorrect. While resting before meals can help with dyspnea, it is not directly related to nutrition education. C. Have about 6 small meals a day. Incorrect. While small frequent meals may be beneficial for some COPD patients, this is not a universal recommendation for all individuals with COPD in terms of nutrition. Question 23. A nurse collaborates with a respiratory therapist to complete pulmonary function tests, PFTs, for a client. Which statements should the nurse include in communications with the respiratory therapist prior to the tests? Select all that apply. I held the client's morning bronchodilator medication. The client is ready to go down to radiology for this examination. Physical therapy states the client can run on a treadmill. I advised the client not to smoke for 6 hours prior to the test. B. The client is ready to go down to radiology for this examination. Correct answer, the correct answer is B because it communicates important information to the respiratory therapist regarding the client's readiness for the PFTs. Going down to radiology indicates the client is prepared for the examination, which ensures the test can be conducted smoothly. Rationale: A. Holding the client's morning bronchodilator medication may impact test results, but this information is more relevant for the healthcare provider interpreting the results, not the respiratory therapist conducting the test. C. Physical therapy's statement about running on a treadmill is irrelevant to the PFTs and does not impact the collaboration between the nurse and respiratory therapist. D. Advising the client not to smoke for 6 hours prior to the test is important for accurate results, but this information is more pertinent for the client and healthcare provider interpreting the results, not the respiratory therapist conducting the test. Question 24. A client with chronic obstructive pulmonary disease, COPD, is being assessed by a nurse. Which finding should the nurse expect? Increased anterior-posterior, AP, chest diameter. Decreased respiratory rate. Weight gain. Productive cough with yellow sputum. A. Increased anterior-posterior, AP, chest diameter. Correct answer, the correct answer is A. Increased anterior-posterior, AP, chest diameter. In COPD, air trapping causes hyperinflation of the lungs, leading to an increase in the AP chest diameter known as barrel chest. This is a classic physical finding in patients with COPD due to chronic airway obstruction. Explanation of other choices: B. Decreased respiratory rate. In COPD, patients typically have an increased respiratory rate due to difficulty breathing. C. Weight gain. Weight gain is not a typical finding in COPD and is more often associated with other medical conditions or lifestyle factors. D. Productive cough with yellow sputum. While a productive cough is common in COPD, yellow sputum is more indicative of a bacterial infection rather than COPD alone. Question 25. What instruction should be included when teaching a client with asthma about using a metered dose inhaler, MDI? Shake the inhaler well before use. Inhale rapidly while administering the medication. Administer the medication while lying down. Hold the inhaler 2 inches away from the mouth while inhaling. A. Shake the inhaler well before use. Correct answer. Rationale for correct answer A. 1. Shaking the inhaler well before use helps ensure proper mixing of the medication. 2. This action helps to distribute the medication evenly for effective delivery. 3. It prevents clogging and ensures the client receives the correct dose. 4. Shake and use approach is essential for optimal therapeutic benefits. Summary of incorrect choices. B. Inhaling rapidly may lead to improper medication delivery and increase the risk of side effects. C. Administering medication while lying down may not allow the client to inhale the medication effectively. D. Holding the inhaler too far away can result in decreased medication intake and reduced efficacy.